Imagine a situation where a medical action, intended to save a life or alleviate suffering, also carries a serious risk of harm, perhaps even death. How do we navigate such morally complex waters, especially when our primary goal is to do good? This is a profound challenge in healthcare, prompting us to examine the nuances of intention and outcome. The principle of double effect is controversial because its application relies heavily on discerning the intent behind an action, which can be incredibly difficult to assess objectively, leading to widespread disagreements about moral responsibility. While it aims to provide a framework for ethical decision-making in situations with both good and bad outcomes, its strict conditions often spark debate and conflicting interpretations among ethicists and practitioners. At its core, the principle distinguishes between an intended effect and a merely foreseen but unintended side effect. For an action to be ethically permissible under this principle, conditions must typically be met. First, the action itself must be morally good or at least morally neutral. Second, the good effect must be the one directly intended, while the bad effect is only foreseen. Third, the bad effect must not be the means by which the good effect is achieved. Finally, there must be a proportionate reason to permit the bad effect to occur, meaning the good effect must outweigh the bad effect. The most contentious aspects often revolve around accurately determining the agent's true intention and judging proportionality, as these are inherently subjective and often open to multiple interpretations. In practice, the controversies of the principle of double effect become evident when healthcare professionals must make critical decisions in areas like palliative care or aggressive cancer treatments. For instance, increasing a pain medication dose to alleviate severe suffering, knowing it might unintentionally hasten death, is often ethically justified under this principle. However, if the primary intent was to shorten life, even to end suffering, the action would be viewed as morally impermissible. Distinguishing between these subtle differences in intention requires profound ethical discernment and often leads to vigorous discussion among ethics committees, patients, and their families. Ethicists sometimes refer to the concept of causal proximity when discussing the third condition, where the bad effect must not directly cause the good effect. This means the therapeutic action must directly produce the good effect, with the bad effect being an unfortunate, separate consequence. The challenges lie not just in evaluating the immediate intent, but also in considering the moral grammar of the action and how it connects effects, making it a powerful yet often debated tool in bioethics. Ultimately, the principle of double effect serves as a vital conceptual tool for framing complex ethical dilemmas, particularly those involving life-sustaining treatments and end-of-life care. Despite its controversies and the difficulties in its application, it compels us to scrutinize our intentions and carefully weigh potential outcomes, fostering a more rigorous and compassionate approach to patient care.